Okay, so let's get into shoulder impingement syndromes. Let's get into the definition. What is, I talked about it earlier. What is shoulder impingement? So, shoulder impingement syndrome occurs when the rotator cuff tendons or the subacromial bursa becomes pinched underneath the acromion, the bony top of the shoulder blade. This condition can cause pain and restrict motion. So what are some of the mechanical factors? Are repetitive overhead movements commonly seen in athletes and workers using overhead activities. You could have poor posture, which narrows the subacromial space, resulting in impingement. Symptoms typically occur a pain that is worse with movement of the arm overhead, and you have limited ranges of motion and stiffness in the shoulder. Typically, you're going to have conservative treatment, right? You're going to have rest and modification of activities, physical therapy, which are going to focus on improving posture, strength, supporting the tissues, and getting motion back into the joint, and anti-inflammatory. I'm always going to look at PRP to regenerate the joint because I fully believe in PRP and its abilities to help heal tissues. And then lastly, surgical interventions if needed. Arthroscopic subacromial decompression, ASD, is typically preferred more than chromioplasty. Surgery is generally considered only after 6 months of failed conservative treatment or for chronic outlet impingement. So when we talk about shoulder impingement syndrome, it is typically a very common condition, and it's typically caused by repetitive shoulder use and poor biomechanics, leading to pain and tendon degeneration around the rotator cuff. MRI and clinical evaluations are critical for the diagnosis and treatment, ranging from conservative approaches like physical therapy and surgical interventions